Hello and welcome to Module 12, Selecting the Best Dressing. Our objectives for this module are to discuss the categories of wound dressings, define the best dressing based on wound characteristics, detail the dressings available on the Lohmann and Rauscher formulary, and introduce best practice guidelines for dressing changes. Selecting an ideal dressing is not always easy. The appropriate dressing will complement the individual plan of care. Information collected through the complete patient and wound assessment will help to guide your dressing choice. Dressing selection considerations include the type of tissue present in the wound base, the wound status, the amount and type of exudate present, the peri-wound tissue appearance, the patient and caregiver ability, and the frequency of dressing change. It's often a good place to start by evaluating the tissue type. When you evaluate the tissue type, if you see epithelium or granulation tissue, the goals of care should be to protect the wound and promote a moisture balance. Considerations should include selecting a dressing that can remain in place as long as possible and maintain an appropriate moisture balance. Product categories would be contact layer dressings, alginates, films, foams, hydrocolloids, and collagens. If the tissue type present in the wound is slough or eschar, the goals of therapy would be to debride necrotic tissue, except for dry, stable eschar, prevent infection, and promote a moisture balance. Considerations would be selecting a dressing that supports autolytic debridement and that can absorb exudate. Also, don't forget about sharp debridement when indicated. Product categories to consider would be alginates, foams, hydrocolloids, and hydrofibers. When we consider exudate amount, if the wound has scant or small amount of exudate, the goals of therapy would be to promote moisture balance, and selecting a dressing that adds moisture or requires less frequent dressing changes would be appropriate. Those product categories are contact layers, hydrocolloids, and foams. If your wound is moderately exudative, we also would like to promote a moisture balance and select dressings that will absorb moisture to prevent maceration. Product categories would include alginates, foams, and hydrofibers. If the wound has a heavy amount of exudate, managing exudate and protecting the peri-wound is the goal of therapy, and we should consider selecting dressings that absorb large amounts of exudate and are indicated for more frequent dressing changes, such as a superabsorbent. Other considerations: if the wound has odor, the goal is to minimize odor. So use any addition to selecting other dressings that treat the underlying cause of odor, such as infection. Product category to consider would be a charcoal dressing. If there is local infection, the goal is to reduce bacteria burden. Of course, treating the cause of infection, if possible, with an antimicrobial or an antibiotic. Selecting a topical antimicrobial primary dressing, and decreasing the spread or systemic infection, which might require systemic antimicrobial therapy in addition to a topical treatment. And the best product category for wounds such as this would be an antimicrobial dressing. Let's talk about different dressing categories. Alginate dressings are derived from calcium salts of seaweed and carboxymethylcellulose. They are available in both pads and ropes. They are indicated for wounds with moderate to heavy drainage and also can be used for wound filling. The advantages are they're highly absorptive, they're easy to apply and remove, they can be used under compression. These dressings can be used in a variety of wounds and can be used as a primary or secondary dressing. The disadvantages are they might cause peri-wound maceration and potentially leave residue and fibers in the base of the wound. Foam dressings are composed of polyurethane foam. They vary in thickness and absorption. They are available in both adhesive and non-adhesive. Indications are light to moderate to heavy drainage. They are semi-occlusive and they help to maintain a moist environment. Advantages are they can be used as a primary or secondary dressing. They are absorptive under compression, easy to apply, have no residue that remains. They do not adhere to the wound bed. They can be used on gentle or friable skin. They also add padding. Disadvantages is the use of foams can macerate if left in place too long, and they can be ineffective for dry wounds. Hydrocolloid dressings are composed of an inner layer of gel-forming agents called hydrocolloid particles, which include carboxymethylcellulose, gelatin, and pectin. They are indicated for mildly exudating wounds only, like minor burns or pressure injuries. Advantages are the inner layer promotes wound healing by absorbing exudate, which is the type of drainage composed of water, white blood cells, and proteins. They do provide a moist healing wound environment, which allows for faster healing and scar reduction. And the outside layer is waterproof, typically made of polyurethane foam or film, which shields the wound from bacteria, foreign bodies, and debris. Collagen dressings are derived from either bovine, equine, porcine, avian, or piscine sources. They are available in sheets, powders, and gels. Indications include wounds that are free of necrotic tissue and large quantities of adherent fibrin or slough, and then also wounds with mild to moderate exudate. Heavily draining wounds are not appropriate for collagen. Advantages are these biomaterials enhance new cell growth by improving fibroblast migration into the wound and helping to promote angiogenesis and reepithelialization. Collagen dressings also support wound healing by binding with and inactivating excess MMPs or proteases. In these instances, the collagen in the dressing will act as a sacrificial substrate so that the proteases don't damage the extracellular matrix and the ECM is thus spared. Disadvantages remain to be cost, and they are also animal-derived products. So currently, L&R products that are available on the formulary are composed of debridement tools such as the Debrasoft Lolly or pad, alginates like Supersorb A, hydrocolloid Supersorb H, foam Supersorb P, antimicrobial Supersorb X plus PHMB, and superabsorbent Vilazorb. Some additional pearls. I always like to say drainage dictates dressing decisions, and there's probably no truer statement in wound management. Drainage or exudate levels will dictate the type of dressing that you use and also dictate the frequency of which dressing changes will occur. It is important to avoid the term sandwich dressing. It doesn't matter how many dressings you layer on a wound, the only product affecting the wound is the one that's touching it. So please do not use active dressings as a secondary dressing. Choose only inert dressings for moisture management or exudate absorptions in secondary dressings. Only use active wounds on the wound base. Here are some additional references. And that completes Module 12. To complete the test, please click on the red test icon at the bottom of your screen with the clipboard and pencil on it to receive your certificate of completion for this module. Thank you.